Okay, guys, let's take a look at these symptoms.
All right, first symptom is Ehlers disease.
There's also omositis.
And don't forget about appendicitis.
I get what you're saying, but the answer is clear as day. It's infectious causes of cancer.
But Dr. Hawks, our theories and research suggest otherwise. Ehlers disease is a viral infection affecting sheep and goats.
While omositis is inflammation of the sheath surrounding the esophagus.
And appendicitis is an inflammatory disorder that affects the appendix.
And none of that interests me in the slightest. They'll recite Wikipedia articles on someone else's watch. You all need to perform a peritidectomy. It's risky and I'm aware of it, but it's the right treatment.
No, you cannot perform your surgery based on whatever advice you got from... What was it again?
I've got an elf doctor who's a Santa Claus at the mall.
Are you joking or just trying to pull a prank on me?
I'm serious, Tracy. His doctorate is in medicine and he knows what he's talking about.
A doctor with experience in cancer treatments? I don't think so.
He's very knowledgeable, believe me. I've seen the results of his work firsthand. It's impressive, to say the least.
You're going to perform surgery on one of your patients based on advice from a mall Santa Claus?
Yes, Tracy. This is my patient, and I know what's best for him.
So what do you expect to tell your patient if they wake up and find that their infections caused by cancer isn't corrected after the surgery?
If they're extra good this year, they will find a 50% discount to their medical bills in their stocking.
So what constitutes as not extra good?
Bitching to me with a hilarious malpractice suit slapped on us by some ambulance-chasing lawyer who sleeps with the mall Santa's wife. That patient will get far more than just coal in their stocking if they mess with us.
Our lawyers are really starting to reconsider which hospital they want to represent with decisions like yours.
I'm sorry, Mr. Thompson, but it seems like we've made a grave mistake.
Who are you talking to?
Sorry, I thought Thompson was your last name.
No, it's Randall.
Oh!
The surgery we performed earlier today was not the right treatment for the patient's condition.
And that's because peritidectomy is not effective against infectious causes of cancer.
Well, I believe the best course of treatment for this situation would be a different surgical procedure altogether.
Yes, one that targets the infectious nature of the disease.
Exactly. We'll have to consult with our other colleagues and discuss this further before proceeding.
What kind of fucking amateurs am I dealing with? You almost killed him. Infectious causes of cancer and peritidectomy.
I know we messed up, Doc Hawks, but what do you think the diagnosis actually is?
Yeah, Frank and I were just wondering.
We're really sorry about this mess up.
The diagnosis. It's not hard to see that he has an actual tumor, for God's sake. Peritidectomy was the wrong treatment from the get-go.
Maybe he went to the wrong mole Santa, committing an act of blasphemy to claustrophobics around the globe.
What the hell are you talking about, Frank?
You told me I had to fill the void with pointless conversation every now and then. Otherwise, Hawks might be led on to something being wrong with this team.
Wrong with this team? It's all three of you. Every goddamn minute of every day. I should send all of you up to the North Pole to do Naked Olympics, and if somehow any of you survive, let you work on another case. I heard about your work in the oncology department. It's quite commendable, Johnson.
Thank you, Hawks. It is a tough job but rewarding. How are things on your end?
Well, as much as I enjoy our discussions about your patients and their fight against cancer, I must admit my current case has been a bit perplexing.
Yes, the patient whose medical history you've been struggling to decode.
Exactly. But I just figured out what's wrong with her, and I'm glad to say she can be saved, Johnson.
That is excellent news, Hawks. You must feel relieved.
Indeed I do. Now, if you'll excuse me, I have a lot of work to catch up on.
Of course. No worries. Good luck with your patient's case and the rest of your day.
Thanks, Johnson. See you around? What are you doing here? We're in an operating room.
What do you think we're doing? Did you have a stroke during lunch or something?
I'm sure what he's wearing is more hygienic than those suits anyway.
That might be true, but it still doesn't excuse him from protocol.
You're right, I should apologize for not following protocol. But let me tell you why we need to reevaluate the diagnosis. Infectious causes of cancer were misdiagnosed. Instead, this is a case of progressive bifocal chorioretinal atrophy.
That's quite a leap.
No, it's not. I solved this during lunch with Dr. Johnson. He was just as astounded by the diagnosis as you are.
Johnson, the guy known for having 100% of his patients with cancer.
Yes, him. But we've all seen Hawks's brilliance in action before.
All right, let's hear this prognosis then.
Progressive bifocal chorioretinal atrophy has a... How to put this delicately? 100% recovery rate when caught early.
How late did we catch it?
I missed reruns of my favorite soap opera, and now I'm gonna be pissed. Good riddance, all of you! Well, another day, another dollar.
Why are you here? I thought you were going home to watch your favorite soap opera.
They've moved on to the news, which I'm not really interested in watching right now. Besides, I'm off to the mall now to give that Santa a piece of my mind.
Oh, for God's sake! Why are you beefing with the mall Santa?
It's not even December, and he's already giving people false hope and fake diagnoses. I can't have that.
You actually believed him and his crackpot health doctor over real doctors who are here year-round.
They're year-round, too. No one else would hire them, and out of pity, a mall decided it was better that they pretended to be useful. I'm gonna stuff Santa's stocking so full of coal he won't be able to shit for a week.
DNI, Hawks. Don't get arrested. Actually, go ahead and get arrested. I don't care anymore.